pregnancy-related deaths are the highest in 60 years. And for Black women, it's become a literal life or death situation. According to the CDC, Black women are 3 times more likely to suffer serious pregnancy complications than white women. On Friday, Vice President Kamala Harris spoke about the U.S. Black maternal mortality crisis at the annual Essence Fest Forum in New Orleans.
When it comes to Black maternal mortality, it has nothing to do with her educational level or her socioeconomic level. It literally has to do with the fact that when she walks into that clinic, that emergency room, that doctor's office, she is not taken as seriously.
My next guest is here to further explain exactly why Black women remain at the heart of this crisis. Joining me now is Dr. Joya Crear-Perry, the founder and president of National Birth Equity Collaborative. Dr. Joya, it's so nice to have you here today on a very serious topic. Why are Black women suffering the most pregnancy complications and maternal deaths?
Thank you so much, Katie, for having me. So we know that the United States does not value birthing people. They don't value women. And as your last segment showed, through our policies at the Supreme Court, we have created a structure that when you add both Blackness, anti-Blackness, and also a belief that women are not fully human, you come up with policies in hospitals and situations where providers ignore us, and then we are more likely to die in childbirth. And this has been consistent for the last 60 years.
So the numbers are showing, Dr. Joya, that at-home births are becoming a common choice among Black women due to reports of racial inequality from medical providers and physicians. In fact, in 2021, the CDC reported that home births increased 21% for Black women, 15% for Hispanic women, and even 10% for white women. So how concerned are you that Black women are resorting to this to be able to give birth amid what's being called medical racism?
Yeah, I mean, we've known for a long time people have made choices to ensure that they can thrive. And so we would blame them for not showing up for prenatal care. But part of the reason they weren't showing up is because when they would go, they would get blamed and shamed and told how they were not good parents. And so we are worried that if we don't stop blaming and shaming birthing people and moms, that they will do things like not be a part of the system. Every other country in the world that has better outcomes than us, which is every other high-income nation, people do home births, but they're a part of a system. There's a midwife that comes. They're a part of a healthcare system. We have even demonized a very normal way to have a baby. Birth should be an exciting time for people. It should be joyful. So people should be able to have their family members there. They should be able to do their traditions. We have demonized all of that. So I'm worried that if we don't stop blaming and shaming people, that's why you see things like Tori Bowie, we see people like Serena and Beyonce, we see folks having complications even when they have wealth, even when they have resource. So what happens to the rest of us when we don't have those things?
To Vice President Kamala Harris's point that we heard at the beginning of your interview, an Associated Press survey reveals that the maternal mortality rate for Black women with a college education is actually almost twice the number of white women with less than a high school degree. So it doesn't make a difference. So socioeconomically, it doesn't make a difference when it comes to your education as well. What are we attributing this discrepancy to?
For sure. And we saw that even from the CDC, when there is when a Black woman and a white woman both have college degrees, it's 5 times more likely to die in childbirth. So just think about that. Despite our income, despite our education, when we show up at the hospital, so you think about when Serena tells that story, or when colleagues talk about having a baby, when they show up and they're dismissed, they're not seen. We know that if you have high blood pressure, if you're a Black patient or a Black birthing person, when you come to the hospital, they might say, oh, her pressure's a little high. And they just let it stay for a long time. And next thing you know, the patient's having a seizure because their blood pressure is too high. So these assumptions and these stereotypes about who we are not, there's no biological basis for race. Me and you are the same human race. Just because we both have skin color and hair that are different doesn't make our kidneys different or our lungs different. So those assumptions, the biological basis of race, is killing us inside of our healthcare system.
You know, I had a really similar conversation, Dr. Joya, with Dr. Uche Blackstock about this. Yes. There's these kind of implicit biases that exist that we need to be honest about, that we need to say, you know what, it shouldn't exist in places like a physician's office unless we create medical deserts. Dr. Joya Crear-Perry, I'd love to have you come back and we'll talk a little bit more, and hopefully the numbers get better for all women.
Thank you. Thank you for even highlighting this. I appreciate it very much. Thank you.
Absolutely.